Before now, with radiofrequency assisted lipolysis with BodyTite, the options were really only surgical, going to the operating room and having traditional liposuction. Now with radiofrequency, we're able to elaborate on our treatments and actually perform them in the office with much less downtime. So we can go in and actually melt the fat by heating it significantly internally so that it's much easier to remove it, so your downtime is much better. A very small incision is made versus the longer incisions, like the full length of the arms or all across the abdomen for an abdominoplasty or brachioplasty. So with this tiny little catheter is what goes internal, and it's heating internal and external to help smooth and tighten up the skin. Once that's done, the fat internally is sort of coagulated and melted, sort of like butter. And then we go in with liposuction and remove that fat from the area that we're treating.
This is significantly different, both from a procedural standpoint, but also from a heal time standpoint. Whereas with the procedure, we are not doing the slice and dice kind of method. There are small incisions that are usually only about 1 centimeter in length, in different locations, usually only about 3 locations for the entire abdomen. Those 3 incisions, that's how we do the liposuction. But the liposuction is similar to an old school liposuction where we use the tool to vacuum assist the liposuction.
Most people at this time aren't as interested in going to the operating room or having significant downtime or having to take a lot of time off of work. And with COVID and different restrictions and hospital closures or surgical suite closures, some of the limitations that have come have made something like this much more popular that can get you amazing results without the risks of exposures in the hospital to other people with illnesses as well. As far as pain is concerned, we use a tumescent numbing solution for the procedure. So we will actually infuse in fluids like in a liter bag that has numbing solution, and so you can be comfortable through the entire procedure and not have pain or discomfort in any of the areas. And if for some reason an area becomes a little uncomfortable, you're awake, you're able to tell us and we can just adjust so that you're not uncomfortable.
Since it is liposuction and we get in there and really work the fat, you will be a little bit tender for the next few days. That being said, it's not like the old school where you can't lift anything for the next 6 months. You literally can go out the next day and have no problems.
We're currently treating abdomens, flanks, arms, and the face, especially that double chin, so that you can have immediate results with reduction in fat and tightening of the skin. A single treatment in our office can take care of those areas and bring you amazing results with minimal downtime and little to no pain at all. We do have on-site physician, myself, I'm an MD, and we have multiple RNs on staff as well. So you're getting experienced, trained staff that can provide amazing services to you. A little bit more on the Morpheus that we do use after the BodyTite procedure is performed. It's the same Morpheus procedure that we do for the face and neck that most of you are familiar with because we do a bunch of those here at our office. For the body handle, instead of 24 pins, it's 40 pins, and it has burst technology, which is the latest technology in radiofrequency, so that we can treat multiple levels with just one push. And so we can treat as deep as 7 millimeters, and with that burst technology, it will treat at 7 millimeters, 5 millimeters, 3 millimeters, 1 millimeter, and then we can also set it to a 6, 4, and 2 millimeter burst as well. So you can be assured that we're going to treat all those levels, but we can do it fast and effectively as well to get you amazing results with the microneedling that really you don't find anywhere else, and it's not available to regular sort of med spas unless you have physician supervision or a physician performing all of those procedures. You're going to get significant improvement similar to surgical results. You can be awake for the procedure. It's very comfortable. You can talk to us through everything and get up and walk out and have minimal recovery time as far as symptoms or pain, anything like that. We do set you up with follow-up appointments. It's all included. So that's going to be, we'll see you same day, then next day, then 1 week, 6 weeks, 6 months, and 12 months as well. And if you need anything in between, we're happy to recheck you in the office as well. If BodyTite or one of our procedures or treatments is something that interests you, I recommend going to our website at roseinjectables.com, and there are multiple selections for different appointment types that you can make. One would be a meeting with Dr. Knies, myself. The other would be if you wanted to schedule a BodyTite specific consult. At that time, we would bring you in, discuss your treatment areas of interest, go over pricing because it's a little bit different for everybody on the treatment areas that we're going to be performing on. And then We can obtain photos, or if you're interested, then we can schedule. At this time, we don't charge for consults, so you're welcome to book and schedule with us so that we can see what areas of interest you have and go over all those specific needs with you in person in detail so it can be customized to you personally.